Here with the Capitol Hill take, Representative John Shadegg from Arizona. Welcome. Good to see you, Representative. So this is a nay from you?
Glad to be with you. Yes, it's a nay. It really demonstrates that Democrats are not listening to the American people. The American people have said they do not want a massive government takeover of health care, and that's what the Baucus plan does. I can't help but throw in, your guest just a moment ago said that we've had a free market in health care. Nothing could be further from the truth. In a free market, I get to pick the product I want to buy, and I can hire it or fire it, and if I don't like it, I can pick another one. That isn't what we have in health care in America today. Your plan is selected by your employer. You don't even know how much it costs. We need patient-driven health care. Baucus doesn't give it to us, and the insurance companies have had too good a deal. They haven't had to compete for my business for most of my lifetime. That's not a good structure.
All right, well, what is the Republican goal? We know that the Democratic goal is to insure the uninsured. Whether they do it with a public option or co-ops, who knows? But if you Republicans are for the same goal of insuring the uninsured American citizens, you're still going to have to pay money to do that, right?
Yep.
So how do you get it?
Well, Republicans have three goals. Cover those who are uninsured. Every Republican bill does it. Cover those who have pre-existing conditions or chronic illnesses. Every Republican bill does it. But then the biggest issue is controlling costs. And we believe the answer isn't to have big government bureaucracy try to hold costs down. Indeed, big government bureaucracy has never succeeded in holding costs down. What we believe in is choice and competition driven by patient choice. You let me pick my own plan, pick my own doctor, and make me in part responsible for choosing efficient health care, and I will drive down costs and I will drive up quality, just like happens in auto insurance and homeowners insurance and life insurance.
And those who industries should pay? How would we pay for that? Because, you know, we're talking about a $700 or $800 billion bill from Baucus. How would it be paid for from your end?
Well, the two pieces that Republicans agree with, which are pre-existing conditions and universal coverage, Republicans would pay for, quite frankly, out of the current system. Pre-existing conditions, we've already offered and passed, when we Republicans were in power, legislation that would say everyone with a pre-existing condition can enroll in a high-risk pool and pay for their health care at the same price as those who are healthy, and the cost is spread across society and all insurers doing business in that area. We've already passed that legislation back in 2006. It didn't go far enough. On universal care, we're already giving Americans universal care. We're paying for it through our hospital emergency rooms and through transfer payments. I would suggest to your listeners that if they're insured right now, about a third of what they're paying is going to pay for somebody else.
Well, you know, Congressman Liz and I have the answer to how it's going to be paid. This is how it's going to be paid. With a credit card of our money. There's going to be an IOU. Well, my grandchildren are going to pay for it. My great-grandchildren. Hopefully, they'll be able to by the time it's all finished.
If you create the impression that it's free, which is what government care is and what third-party employer-provided care is, then the cost goes through the roof, and our grandchildren and our great-grandchildren will pay. You cannot create the impression that it's free.
All right. Thank you very much, Congressman John Shadegg. Good to see you, sir. Thanks a lot.